But one thing I've learned a lot about healthcare. I found healthcare sort of like not of tremendous interest, but it was very important. And I made it of tremendous interest.
Vice President Trump talking to the House Republicans yesterday as healthcare continues to emerge as a major flashpoint, not only within the party, but across the country. The House is expected to vote on extending the Affordable Care Act tax credits tomorrow after four swing district Republicans bucked party leadership last month to join Democrats in signing a discharge petition. And I will say also, Willie, while I was watching, I think football this past weekend, I saw a Trump ad that talked about health care and going after private health care insurance companies. Looked like it was written, for a Democratic presidential candidate. So somebody in Donald Trump's orbit certainly is understanding this. The president's talking about it. And we were even saying back during the government shutdown that when he engages, because he was traveling across the world, now we get some wars going on, but when he engages, he would most likely have the political instincts that a lot of House Republicans do not have right now. And that is health care is going to be, if not the major issue of the 2026 elections, one of the top two or three.
Yeah, it kind of got pushed off to the back burner over the holidays because of Venezuela, but this is coming right back because it does affect so many people. And despite the fact that Obamacare has become something of a dirty word from Republicans, the benefits, including these subsidies, are enjoyed by people of all parties.
Well, it's
in all
yes.
districts, as Marjorie
popular.
Taylor Greene was the first to say, in her very, very red district, they need these subsidies. They're very popular. Steve Ratner's got some charts on all this, the former Treasury official. Morning Joe economic analyst is over as what we've determined, I believe, is the southeast wall.
Southeast wall.
In
the old New York Times
I like
building.
it.
That's right.
Times building.
The place where he once ruled.
Yeah, what floor did you rule here, Ratner? Because you told us you were the guy.
Yeah,
you would walk down the halls and you would scream, do this, do that.
Yeah.
The power that you had in the old New York Times.
I was the lowliest of the low. I was a reporter trainee making $17,500 a year.
So why did you have the power to go with your chomping on your cigar going, stop the presses, stop the presses?
I didn't have the power to do nothing. I was down on the third floor in the newsroom, very happy as a young reporter, but I was a young reporter.
Well,
We were all young ones.
You've got the power of the charts right now. So let's start with your first one, which gets into just how many people rely on these healthcare subsidies that we've been talking about.
Sure, Willie. Look, healthcare is an unbelievably confusing subject. So it seemed to me we might start with a little bit of level setting just to help people understand what we're talking about. Out of our 330 million or so Americans, almost exactly half of Americans get their healthcare from their employer, 161 million. Medicaid and Medicare represent about roughly another third of our healthcare. What we're talking about now is the so-called marketplace, where individuals who don't have these things go to buy coverage. And this was established under Obamacare. And so there are 21 million people who are at risk at the moment because these health care subsidies actually expired on January 1st, lost, as you said, a bit amidst the Venezuela thing. And then you have the military. And we still have, incredibly, 27 million people in this country who don't have health insurance, richest country in the world, and we can't provide health care for all of our folks. So back in the early Biden administration, they passed an expansion of these subsidies that helped these 21 million people. And so, lo and behold, you had roughly 10, 11 million people getting this. You passed the subsidies, and now you have these 21 million people getting it. These are the percentage of the people who get the subsidies to buy this health care. Roughly everybody who buys health care in the marketplace gets a subsidy. These are essentially all lower income people near the poverty line. Poverty line for an individual is $16,000 in this country, so you can imagine none of these people make a heck of a lot of money by American standards. And so the subsidies are a key element of why they're able to do this. And this is what's at risk here now, is the health care for the 21 million people. The House passed that piece of legislation, as you mentioned. Nobody thinks it's going anywhere in the Senate at the moment. The Senate's trying to cobble together a bill. But meanwhile, these things expired January 1st, and people are having to make their decisions about whether to buy health care or not.
And so, Steve, as we move to your second chart, for those 21 million people, this lift in the cost is not marginal. This can be backbreaking for a lot of families.
It is not close to being marginal. It is absolutely backbreaking. So let's just take somebody who makes $35,000 a year. He or she was paying about $1,000 for their health care. It is now going to go up by $1,600 to $2,600. If you make $35,000 a year, $1,600 a year is obviously a heck of a lot of money. And so all the way across the board, it is resulting in massive increases in premiums, roughly a doubling for people who buy their insurance in this marketplace. And as I'll talk more about in a second, a number of them, therefore, will have to drop out of this and not have health insurance at all. But in the meantime, let's talk about the geographical distributional effects of this, because it's not equal. So these dark-colored states, which are red states for reasons I'll explain right now, are the biggest losers in this. Over 10% of their population is enrolled in these marketplaces and are going to be affected by this. Why are they the red states? Because the red states did not opt in to the expansion of Medicaid that was passed under the Affordable Care Act. And so a lot of their folks, because they did not opt in to these Medicaid expansions, went into the marketplace. And so they have a disproportionately large number of people buying their insurance through the mechanism I just described. So they're going to be amongst the biggest losers. Obviously, given the amount of effort that the Republicans are now trying to put into coming up with a health care bill, they do seem to recognize that this is not the outcome that they should want. But it's very complicated. You have people on all sides of the issue. Whether they'll get something done or not, who knows? But these are the people who are going to be most affected.
And the loss of these tax credits, Steve, as we look at your third chart, is compounded by the one big, beautiful bill and some changes made to Medicaid.
Yeah, so the one big, beautiful bill also actually had an even bigger set of changes to the healthcare system that will go to the negative. Particularly, they cut back on the Medicaid eligibility. For example, they imposed work requirements. When you put the two things together, here's what is expected to happen based on CBO and KFF, which is an independent healthcare firm, have come up with. So back here, we had 45 million people uninsured. Obamacare took it all the way down, down, down to this 25-ish number, roughly where we are now. A lot of improvement, still not obviously perfect by any stretch of the imagination. But you now have these two pieces of legislation. The changes in the big, beautiful bill, the Medicaid stuff that I mentioned, the work requirement, is estimated to cost 10 million people their health care between now and 2035. This change is going to cost another 4.2 million people their health care because they can't afford it. They're going to drop out between now and 2035. The result is that by 2035, absent something else, we are going to be 70% of the way back to where we were before the Affordable Care Act was passed. And so without really talking much about the Affordable Care Act in name anymore, because the Affordable Care Act has actually become popular, the Republicans are essentially going to eliminate 70% of its benefit, kind of bit by bit, piece by piece, without ever announcing that they are going to repeal Obamacare because they realized that was a political loser. So when you again put these two pieces together, what states are hit the hardest? 7 out of the 10 of them are red states, led by Louisiana and Florida. And it's different effects in different places. Some of them are more the big, beautiful bill. Some of them are more these enhanced tax credits. But you're looking at losses of health care upwards of 7% of the population in these 10 states.
All right. Morning Joe, economic analyst Steve Ratner. Thank you very much.
Thank you, Steve.
Very powerful, Steve Ratner. Okay.
When he walks out, he'll scream, "Stop the press."
He might.
Oh, yeah.
Just throw down his script.
A cloud of smoke.
Who wrote
Yeah.
this headline?
Yeah. Like road
Snapping
runners.
his suspenders.
Yeah. All right, still ahead.
What bar did you guys go to, Steve, after you finished your reporting?
Yeah, after your shift.
Well, after you did your shift, what was the bar around here that
Sardi's.
Sardi's.
Well, there was Sardi's on 44th Street. We could go out the back door. And then there was a place called Goff's, which was across the street, which is kind of where the pressmen went. And what we call a dive bar today was across the street.
Oh.
So that was fun, too. So, yeah, we had some bars.
Wait,
We had some bars.
Give us your best story from the dive bar.
Wow.
Well, I
Your
don't
best journalistic story, Steve.
is when, like, the pressman told us to get the hell out. It wasn't our bar; it was their bar.
There you go. That's a good
All
story.
right, that was